Genius Solutions, How to Meet EHR Meaningful Use Modified Stage 2 Objectives for 2017. This video will go over the following topics: important information, measure objectives, descriptions, threshold, and exclusions, measure demonstration within ehrTHOMAS, clinical quality measures, attestation and audits, and helpful resources. The Medicaid Incentive Program and the Medicare Incentive Program are two separate programs with their own criteria, requirements, regulations, and incentives. It is important to know which program you are associated with and follow the appropriate guidelines. If you are participating in the Medicaid Incentive Program, this webinar applies to you. ehrTHOMAS is certified to the 2014 edition. This means that any providers participating in the Medicaid EHR Incentive Program will be subjected to the Modified Stage 2 Objectives. The reporting period for 2017 for all returning participants and new participants is a minimum of any continuous 90-day period starting from January 1st through December 31st, 2017. Your data for the 2017 EHR reporting period must be submitted by February 28, 2018. All EPs must meet the following objectives for meaningful use. We will be touching base on every single one of these objectives, their thresholds, the exclusions, and how to reach each measure using ehrTHOMAS. Protect electronic health information. Objective: protect electronic health information created or maintained by the certified EHR technology through the implementation of appropriate technical capabilities. Measure: conduct or review security risk analysis in accordance with the requirements under 45 CFR 164.308 parent A, parent 1, including addressing the encryption security of the data stored in the certified EHR technology in accordance with the requirements under 45 CFR 164.312 parent A, parent 2, parent 4, and 45 CFR 164.306 parent D, parent 3, and implement security updates as necessary and correct identified security deficiencies as part of the provider's risk management process for EPs. There are no exclusions for this objective. CMS requires all eligible participants to conduct a security risk analysis. Please refer to the Security Risk Analysis tip sheet on the CMS website for more detailed information about this measure. If the office has their own hardware technician, please contact them regarding security risk analysis. There are also some great websites like healthit.gov that will provide free tools to assist providers in completing this measure. Clinical Decision Support. Objective: use clinical decision support to improve performance on high-priority health conditions. There are two measures to this objective. Measure 1. Implement 5 clinical decision support interventions related to 4 or more clinical quality measures at a relevant point in patient care for the entire EHR reporting period. Absent 4 clinical quality measures related to an EP's scope of practice or patient population, the clinical decision support interventions must be related to high-priority health conditions. There are no exclusions for Measure 1. Measure 2. The EP has enabled and implemented the functionality for drug-to-drug and drug allergy interaction checks for the entire EHR reporting period. Measure 2 Exclusion. Any EP who writes fewer than 100 medication orders during the EHR reporting period. There are 2 components to complete this measure: implementing 5 CDS rules and enabling drug-to-drug and drug-to-allergy interaction checks. To see if CDS rules were implemented, click on Code Files, and then click on CDS Rules. This screen will show all CDS rules that have been implemented in your EHR. To add a new CDS rule, click on Add. For this demonstration, we'll be using PQRS Measure 163, Diabetes Foot Exam. This measure asks for patients aged 18 through 75 years of age with diabetes who've had a foot exam during the measurement period. We will enter the name of the rule here. Underneath, we will enter in the rule source. This is the reference of where the rule came from. We will now attach conditions in order to make this rule populate. Let's first define the patient's age. click on Add Group. To indicate that we want the rule to show up for patients over the age of 18, we will select Patient Age in the dropdown, then select Greater Than. Then type the age of 18. Since we do not want to add this rule to patients over the age of 17, we need to limit our rule. To do this, click on Add Group again, then the patient's age, then less than, the age of 75. This CDS will be applied to patients who are older than 18 and less than 75. Now that we have defined the age range, we need to find patients who have an active condition of diabetes. We'll click on Add Group again, and then in the drop-down find Conditions. Click on the magnifying glass to search for a condition. We'll type diabetes in the search bar, and then select the code that we want to use. Then click on Select. In the next drop-down menu, we'll have to click on Active. This group is now selecting patients that currently have an active diagnosis of E11.9. Click on the Add item to add additional diagnoses. Again, we'll have to select Conditions, and click on the magnifying glass to search for another condition. In the search bar, search for diabetes. Click on the diabetes code that you would like to use, and then click on Select. If your office has more diabetes codes, you will need to repeat this step until all your codes are entered into this rule. This rule is now filtering our patient list by patients older than 18, less than 75, and patients who have a diagnosis of E11.9 or E10.621. Click Save to save this report. If you require additional assistance, please contact Genius Solutions EHR support. If the patient falls under the criteria of the CDS rules, you will notice that there is now one active alert on this patient. By clicking on the alert, it will tell you how this patient falls under the criteria. The patient is between the ages of 18 and 75 and has diabetes. The second component to this measure is drug-to-drug and drug-to-allergy interaction checks. ehrTHOMAS automatically checks the drug-to-drug and drug-to-allergy interaction before completing an electronic prescription through Doctor First. For example, click on the Medication module, and then click on Doctor First. You will be redirected to the Doctor First webpage. Click on the Prescribe button at the top to prescribe a new medication. Type in the appropriate prescription for the patient, and then click on Find. Select the prescription you want to prescribe, and the user will be prompted with an alert after selecting a medication that will cause an adverse reaction. This patient's allergic to amoxicillin, so this alert popped up. CPOE for medication, laboratory, and radiology orders. Objective: use computerized provider order entry for medication, laboratory, and radiology orders directly entered by any licensed healthcare professional who can enter orders into the medical record per state, local, and professional guidelines. There are 3 measures to this objective. Measure 1. More than 60% of medication orders created by the EP during the EHR reporting period are recorded using computerized provider order entry. Measure 1 exclusion. Any EP who writes fewer than 100 medication orders during the EHR reporting period. Measure 2. More than 30% of laboratory orders created by the EP during the EHR reporting period are recorded using computerized provider order entry. Measure 2 exclusion. Any EP who writes fewer than 100 laboratory orders during the EHR reporting period. Measure 3. More than 30% of radiology orders created by the EP during the EHR reporting period are recorded using computerized provider order entry. Measure 3 exclusion. Any EP who writes fewer than 100 radiology orders during the EHR reporting period. There are 3 components to this measure. We will start with medication orders. In an open encounter, click on the Medication module. Then click on Doctor First. You will be redirected to the Doctor First webpage. If this is your first time entering a medication for your patient, you will be prompted to add in patient's pharmacy and allergy information. Once you've completed this, click the Prescribe button. Type in the appropriate prescription name, and then click on Find. Select a medication from the generated list. Do not free text the medication. Enter in the appropriate drug information, then click on Continue. Review the prescription on the next screen, and if everything is correct, click OK. Make sure the prescription that you want to send is selected, and then type in the signature password. You have different ways of sending out a prescription. You can send in print without sending, and sign without sending. Click on Send to send your prescription. You have just now e-prescribed your medication for your patient. Click on Return to EMR when complete.
There are two ways to use CPOE for laboratory orders: by manually ordering a lab or by importing lab results from a lab interface. To manually order a lab in an open encounter, click on the Labs module. Then click on the Add button. Select the appropriate location from where the lab will be ordered from the drop-down menu, and fill out additional miscellaneous information such as the ordering physician and the date for which to order the labs. Click Accept. Then click on the appropriate lab to be ordered and click Next. Scroll down to find the most recent lab you just ordered to confirm. Then click Close. To import results from a lab interface, click on the Labs button. Select the appropriate provider from the drop-down menu. The name of the patient should appear next to patient or to the area to the right. I will be manually typing in the name of the patient for demonstration purposes. To select a location, click on the magnifying glass next to Lab, and then select the appropriate lab. Select an encounter for which to attach the lab results, or click the Add button to add a new encounter. Then click on the Import button next to the name. Click on the Recent tab to sign off on the lab results. If you are unable to sign off on the lab results, that means there are more lab results waiting to be imported for this particular patient. To use CPOE for radiology orders in an open encounter, click on Diagnostic Orders. Click on the Add button to add a new diagnostic order. Select the appropriate facility from which to order the diagnostic test from, and then select the appropriate diagnostic test or order. You may fill out the miscellaneous information if desired, and then click Next. If everything is correct on your screen, click the Save button. The next screen to generate will be the prescription screen for the diagnostic order. Print out the prescription screen and have the provider sign the prescription and hand it to the patient. You have now just created a diagnostic order.
If you do x-rays in-house, there is a way to create a radiology order directly from the Procedure module. Click on Procedures, and find the appropriate x-ray code that you'll be using. Then click on Next. Ensure that this checkbox for Create Order has been selected. Then perform your procedure. Once you have performed your procedure, click on Save. You will notice that on the task list there is a diagnostic order. Click on the DX order to review that radiology order. E-prescribing. Objective: generate and transmit permissible prescriptions electronically. Measure: more than 50% of permissible prescriptions written by the EP are queried for a drug formulary and transmitted electronically using certified EHR technology. Exclusion: any EP who writes fewer than 100 permissible prescriptions during the EHR reporting period, or does not have a pharmacy within his or her organization, and there are no pharmacies that accept electronic prescriptions within 10 miles of the EP's practice location at the start of his or her EHR reporting period. This measure is done in the same way as CPOE for medications. To prescribe a medication, click on the Medications module. Then click on Doctor First. You will be redirected to the Doctor First webpage. If this is your first time entering a prescription for your patient, you'll be prompted to add in the patient's pharmacy and allergy information. Once you've completed this, click the Prescribe button. Type in the appropriate prescription name, and then click on Find. Select a medication from the generated list. Do not free text a medication. Enter in the appropriate drug information, and then click on Continue. Review the prescription on the next screen, and if everything is correct, click OK. Make sure the prescription you want to send is selected, and then type in the signature password. Then click on Send to send your prescription. Click on Return to EMR when complete. Health Information Exchange. Objective: the EP who transitions their patient to another setting of care or provider of care, or refers their patient to another provider of care, should provide a summary of care record for each transition of care or referral. Measure: the EP that transitions or refers their patient to another setting of care or provider of care must 1. Use certified EHR technology to create a summary of care record, and 2. Electronically transmit such summary to a receiving provider for more than 10% of transitions of care and referrals. Exclusion: any EP who transfers a patient to another setting of care or refers a patient to another provider less than 100 times during the EHR reporting period. If the provider is transitioning a patient to another setting of care, the office must indicate that the patient has transitioned out of the office. To indicate that the patient has transitioned, click the Change Encounter Header Information button. Select the appropriate transition status from the drop-down menu, and then click the Transition Out checkbox. Then click Save. A clinical care document now must be created. Click on the Create CCDA button, and then either click Create CCDA or Print CCDA. Once a CCDA has been created, a screen will appear to indicate so. The second portion of this measure is to send a summary of care to the provider that you're transitioning the patient to via ehrTHOMAS or through a health information exchange program. ehrTHOMAS can send direct messages to other providers as long as the other provider's EHR is associated with the Blue Button Plus community group or a direct trust group. Your office will need to obtain the other provider's direct address. Once you have that address, you must record that information inside of ehrTHOMAS. To do this, click on Code Files, then click on Referrals. Select the appropriate provider, and then click on Edit. Enter in the provider's direct address into the direct address input area. Then click on Save. Once you have the direct address for your other provider, you can now click on the Send Direct button. The Send Direct message screen will appear. The provider will already be filled out for you. Start typing in who you want to send the clinical care document to, and click on his or her name. The patient and the encounter will already be selected, so type in a subject and a message. Once you're done filling out the subject and the message, you can click on Send to send that message to the other provider. If the provider you want to send a CCDA to is not associated with the Blue Button Plus community group or the Direct Trust community group, you must indicate that the CCDA was sent through HIE or through a secure transmission by clicking either the Sent to HIE or Sent to Secure Transmission checkbox. You will need to indicate which provider you're sending it to by clicking on the magnifying glass and selecting your provider. It is important that you send the CCDA on the date declared in the Sent On input area. The Send Secure Transmission checkbox works the same way as the Send to HIE checkbox. Once you have indicated in your EHR that you are sending the CCDA through an HIE or a secure transmission, you must go to your HIE and send the message to that provider, or send your CCDA through that secure transmission. Patient-specific education. Objective. Use certified EHR technology to identify patient-specific education resources and provide those resources to the patient if appropriate. Measure. Patient-specific education resources identified by the certified EHR technology are provided to patients for more than 10% of all unique patients with office visits seen by the EP during the EHR reporting period. Exclusion. Any EP who has no office visits during the EHR reporting period.
There are 3 ways to meet this measure: by printing out preloaded educational documents, indicating that verbal education was provided, and/or clicking Medline Plus icon. To print out educational documents, click on the Education module. Click on the appropriate preloaded document, and then click Next. Select Open File to print out the document and hand it to the patient, followed by Complete when you're done. Click Save to save your results. To indicate that verbal education was provided, again, click the Education module and select Add Free Text Education. Type in your caption and the type of verbal education that was provided, and click Save. Click Next, followed by Complete, and then Save to save your results. To use the Medline Plus icon, you can find it in the Medications module and the Condition Tracking module. You will find the icon next to the prescribed medication and next to the diagnosed condition. Clicking the Medline Plus icon will redirect you to a web page containing information on the diagnosis or medications related to the particular patient. For example, clicking in the Medications icon, followed by the Get Medline Plus Connection Info, redirects you to the following website. Here you will find the information on the medication or diagnosis related to the particular patient. You may print out the document and hand it to the patient.
Medication reconciliation. Objective. The EP who receives a patient from another setting of care or provider of care or believes an encounter is relevant should perform medication reconciliation. Measure. The EP who performs medication reconciliation for more than 50% of transitions of care in which the patient is transitioned into the care of the EP. Exclusion. An EP who was not the recipient of any transitions of care during the EHR reporting period.
This must be done for every patient that is transferred into the office. There are 2 steps in meeting this measure: indicating that the patient is a transition into the office and filling out the medication module. To indicate that the patient is a transition into the office, create or open a new encounter. If the current encounter screen does not appear, you may click the Change Encounter Header Info button. Change the transition status appropriately from the drop-down menu, and make sure the Transition Out box is not checked off. Click Save to save your results. Now you must perform medication reconciliation for the patient. This must be done through the Medications module by following the same steps in the CPOE and e-prescribing measures.
Patient Electronic Access, or VDT. Objective. Provide patients the ability to view online, download, and transmit their health information within 4 business days of the information being available to the EP. There are 2 measures to this objective. Measure 1. More than 50% of all unique patients seen by the EP during the EHR reporting period are provided timely access to view online, download, and transmit to a third party their health information subject to the EP's discretion to withhold certain information. Measure 1 exclusion. Any EP who neither orders nor creates any of the information listed for inclusion as part of the measures except for patient name and provider's name and office contact information. Measure 2. More than 5% of unique patients seen by the EP during the EHR reporting period, or his or her authorized representative, view, download, or transmit to a third party their health information during the EHR reporting period. Measure 2 exclusion. Any EP who neither orders nor creates any of the information listed for inclusion as part of the measures except for patient name and provider's name and office contact information, or conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabits per second broadband availability according to the latest information available from the FCC on the first day of the EHR reporting period. There are 2 components to this measure: providing the patient with the ability to view, download, or transmit their health information online, and have the patient view, download, or transmit their health information. To provide the patient with the ability to view, download, or transmit their health information online, in an open encounter, click on the patient's name or picture to open the patient edit screen. Scroll down to the bottom and click the drop-down for Health Vault. Then click on the Connect to Health Vault button. Fill out the security question and answer and make sure the patient knows what the security answer is, as it's required for registration. Enter in the patient's email address if the Send email area isn't filled out. Then click on Send. The Microsoft Health Vault instructions will appear, and you can print out the instructions on how to set up their Health Vault account by clicking on Print. The patient will also get instructions sent to their email. Once the invitation to register for Health Vault has been sent, information regarding the registration will show up. It will show the expiration date of the registration, the last time the EHR has checked to see if the patient has signed up with Health Vault, the ID code, which is a security feature for Health Vault, the patient's name, the security question, the security answer, and the current status of the patient's registration. To check if the patient has created a Health Vault account that is associated with your office, click on the Check for Complete button. If the patient has not completed the registration process, the screen will not change. It is important that the user reissues the Health Vault access at every visit if the patient has not completed the registration. If the patient has completed the registration, clicking on Check for Complete will show the date of when the patient was registered for Health Vault, the date of the last CCDA created for the patient, and the status changed from pending to complete. Now, when you create a CCDA, you will have the ability to send the CCDA via Health Vault. You must send the CCDA to Health Vault if the Health Vault registration has been completed. To do this, click on the Create CCDA button, and then click Send to Health Vault. A pop-up will appear notifying you that the CCDA was sent to Health Vault and asking you whether or not you want to view the CCDA. Go ahead and click on No. By default, the system will automatically create a CCDA when the note has been signed. When you see the CCDA created screen, the Send to Health Vault button will be illuminated, and you can directly send the CCDA that was created to the patient's Health Vault account. The second component to this objective is having the patient view, download, or transmit their health information online. It is best practice to walk through the registration process with the patient to ensure they have registered with the Health Vault, a CCDA was sent to the patient's account, and the patient has reviewed their health information. To view which patient has viewed, download, or transmit their health information, go to Reports, and then click on VDT Report. Enter in the start date and the end date of your reporting period. You can click on Search Health Vault to pull direct patient data from the Health Vault servers, or click on Search Your Data to pull information from your system. For additional help setting up a Health Vault account, please see our video on ehrTHOMAS and Health Vault, or contact Genius Solutions EHR support. Secure electronic messaging. Objective: use secure electronic messaging to communicate with patients on relevant health information. Measure: for at least 5% of unique patients seen by the EP during the EHR reporting period, a secure message was sent using the electronic messaging function of certified EHR technology to the patient or the patient authorized representative, or in response to a secure message sent by the patient or the patient authorized representative during the EHR reporting period. Exclusion: any EP who has no office visits during the EHR reporting period, or any EP who conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabits per second broadband availability, according to the latest information available from the FCC on the first day of the EHR reporting period. Before you can send a message to a patient, the patient's direct address must be obtained and entered into the appropriate field inside of ehrTHOMAS. The patient's direct address can be found on the main page of the patient's Health Vault account under Health Messages. Once you have obtained the patient's direct address, you will need to go into their chart and click on the patient's name or their picture. Click on Other Demographics, and scroll down to find direct address. Enter in the direct address here. Then click on Save. Now you can send a message to the patient. Click on the Message button, and then click on Direct Messages. If you do not see the Direct Message tab, please contact Genius Solutions support. From here, click the Add button. Select the appropriate provider in the dropdown, and start typing in the patient's name. Then click the patient. If you do not see your patient in the dropdown, you do not have their direct address filled out in his or her demographics. Then fill out the subject and message. Once your message has been filled out, click on Send. If you have received a message from your patient, click on the message, and then click on View. You will see that a patient is not associated with this message. Add the direct address to the patient by clicking on the Attach to Patient button. Search for your patient, and then click on Select. To reply to this message, click on the Reply button, and then fill out the form appropriately. Once the form has been filled out, click on Send. Public Health Reporting. Objective: the EP is an active engagement with a public health agency to submit electronic public health data from certified EHR technology, except where prohibited and in accordance with applicable law and practice. Measure: the public health reporting objective for EPs includes 3 measures. In 2017, EPs must attest to at least 2 measures. 1. Immunization Registry Reporting. 2. Syndromic Surveillance Reporting. And 3. Specialized Registry Reporting. We will go through each measure option and their exclusions. Measure 1. Immunization Registry Reporting. The EP is an active engagement with a public health agency to submit immunization data. Exclusion: any EP meeting one or more of the following criteria may be excluded from the Immunization Registry Reporting measure if the EP does not administer any immunization to any of the populations for which data is collected by its jurisdiction's immunization registry or immunization information system during the EHR reporting period, operates in a jurisdiction for which no immunization registry or immunization information systems is capable of accepting the specific standards required to meet the certified EHR technology definition at the start of the EHR reporting period, or operates in a jurisdiction where no immunization registry or immunization information system has declared readiness to receive immunization data from the EP at the start of the EHR reporting period.
ehrTHOMAS has the ability to export HL7 files for immunizations in the states of Michigan and Florida. If your practice performs any immunizations, the setup to send electronic data has already been completed. There are two ways to send electronic data to immunization registries: by individual vaccinations or by batch. To send HL7 files by individual vaccinations, in an open encounter, click on the Immunizations module. Then click on the drop-down arrow next to a Perform Vaccination on the left side of the screen under Vaccination Received. Click Create HL7. To send HL7 files by batch, click on the Reports button, and then click on Immunization. Complete the appropriate fields, and then click the Export button.
Measure 2. Syndromic Surveillance Reporting. The EP is in active engagement with a public health agency to submit syndromic surveillance data. Exclusion. Any EP meeting one or more of the following criteria may be excluded from the Syndromic Surveillance Reporting measure if the EP is not in a category of providers from which ambulatory syndromic surveillance data is collected by their jurisdiction's syndromic surveillance system, operates in a jurisdiction for which no public health agency is capable of receiving electronic syndromic surveillance data from the EPs in the specific standards required to meet the certified EHR technology definition at the start of the EHR reporting period, or operates in a jurisdiction where no public health agency has declared readiness to receive syndromic surveillance data from the EP at the start of the EHR reporting period.
To produce the syndromic surveillance report, click on Reports, followed by Syndromic Surveillance. Select the appropriate timeline and the appropriate doctor, and then click the Export button.
Measure 3. Specialized Registry Reporting. The EP is in active engagement to submit data to a specialized registry. Exclusion. Any EP meeting one or more of the following criteria may be excluded from the Specialized Registry Reporting measure if the EP does not diagnose or treat any disease or condition associated with or collect relevant data that is collected by a specialized registry in their jurisdiction during the EHR reporting period, operates in a jurisdiction for which no specialized registry is capable of receiving electronic registry transactions in the specific standards required to meet the certified EHR technology definition at the start of the EHR reporting period, or operates in a jurisdiction where no specialized registry for which the EP is eligible has declared readiness to receive electronic registry transactions at the beginning of the EHR reporting period. Clinical quality measures. Eligible providers still need to report clinical quality measures electronically. Reporting CQMs by attestation for the EHR incentive program does not count towards CQM reporting or other quality programs such as PQRS. Each state determines the form and manner of reporting CQMs for their Medicaid EHR incentive programs. Genius Solutions recommends to check with your state's program for more information on how to report these measures. If you are associated with a specialized registry, please contact Genius Solutions for additional support. Providers must report on 9 total measures from 3 different domains. Domains are as follows: patient and family engagement, patient safety, care coordination, population and public health, efficient use of healthcare resources, and clinical processes and effectiveness. ehrTHOMAS is certified for the following measures: CMS 69, Preventative Care and Screening, Body Mass Index, Screening and Follow-up; CMS 117, Childhood Immunization Status; CMS 122, Diabetes Hemoglobin A1C Poor Control; CMS 123, Diabetes Foot Exam; CMS 125, Breast Cancer Screening; CMS 127, Ammonia Vaccination Status for Older Adults; CMS 130, Colorectal Cancer Screening; CMS 138, Preventative Care and Screening, Tobacco Use, Screening and Cessation Intervention; CMS 139, Screening for Future Fall Risk; CMS 147, Preventative Care and Screening, Influenza Immunization; CMS 155, Weight Assessment and Counseling for Nutrition and Physical Activity for Children and Adolescents; CMS 156, Use of High-Risk Medication in the Elderly; CMS 163, Diabetes Low-Density Lipoprotein Management; CMS 165, Controlling High Blood Pressure; and CMS 182, Ischemic Vascular Disease, Complete Lipid Panel, and LDL Control. To review the certified measures inside of ehrTHOMAS, click on Reports, then click on System Measures. On the left tab, click on Clinical Quality Measures, and here you'll be able to see all of our certified measures. It is strongly recommended that providers select CQMs that are relevant to their patient population or scope of practice. Genius Solutions will not pick CQMs for you. Reporting zeros is acceptable for meeting the CQM's meaningful use objective for the reporting period. For more information on how to meet each CQM in ehrTHOMAS, please review our clinical quality measure video. Attestation and audits. Here at Genius Solutions, we have seen a lot of attestations and audits, so here's a couple of tips that will help you through this process. Make sure you're registered with CMS and with your state. Please make sure all your providers have a username and password to access your state's attestation website. ehrTHOMAS is certified for Meaningful Use 2014. Therefore, you must attest with modified Stage 2 measurements. You must report numbers that are over threshold. So if the threshold states more than 50%, you must have 51% or higher. It is important that the office checks their meaningful use numbers every week to ensure that the provider is meeting their measures. To run a system measure report or a clinical quality measure report, click on Reports, and then click on System Measures. Type in the beginning of your reporting period and the end of your reporting period. Select the appropriate provider. Click on Select All, and then click on Run. This screen will indicate if the provider is meeting his or her measures. If the percentage is in green, the provider is meeting their measure. If the percentage is in red, the provider is not meeting that measure. To see the list of patients in the numerator and denominator, click the drop-down arrow. You can print the list of patients by selecting the measure and then clicking Print Patients. This will allow you to track which patients are missing a meaningful use objective. To print the full system measure report, click the Print button. To run a clinical quality measure report, click on the Clinical Quality Measure tab. Then select which measures you'd like to track. Select the year, the range, and the provider, then click on Run. To print the full report, click the Print button. During your attestation, CMS will ask for the ehrTHOMAS certification number. Our certification number is as follows: A01055FACEAN. In case of an audit, please have the following: proof of purchase of ehrTHOMAS, proof of a security risk analysis, documentation on all measurement exclusions. For instance, if less than 100 medication, laboratory, or radiology orders, the meaningful use report should reflect that, or any documentation of public health exclusions, documentation referencing all CDS rules used, a copy of your meaningful use report for the appropriate reporting period, and a copy of any documents regarding registry measures. Please review the following websites for additional help: Centers for Medicare and Medicaid Services for the latest industry news, Genius Solutions website for product information and services, and Genius Solutions YouTube page for educational videos about our software products. This concludes our video on how to meet modified Stage 2 objectives in ehrTHOMAS. If you have any additional questions, feel free to give our support team a call at 586-751-9080, Monday through Friday from 8 a.m. to 6 p.m. Eastern Standard Time. Thank you so much for watching.